Namaste, I'm Dr. Siri, fertility expert with more than 15 years of experience practicing at Karuna Fertility and Maternity Center, Nagarbhavi, Bengaluru. It is very important to know the indication for IVF procedure. So that will determine as to how we are going to go about, like what injections to be used and what is the dosage. So there are these injections are given basically to hyperstimulate the ovaries. So ovaries is a place where there are eggs, and we want to stimulate the ovaries so as to get many eggs rather than just one egg which is naturally produced every month. So these hormonal injections are given to stimulate these ovaries. Now there are three categories of women. One is a hyper responder who respond very easily and who also respond in large number of eggs, who produce larger number of eggs. Then there is hyporesponder who have very low reserve of eggs, and they are most of the times elderly women, or they could have had surgeries or whatever, the reserve is low. So they are the hyporesponders. And there is another category who are normal responders who have normal number of eggs and will respond as predicted. So in hyperresponders, we usually start injections of a lower dose. So we could be starting somewhere from 150 international units per day to up to probably 250 or 275 maximum we would be using for a hyper responder, where we are already expecting that the woman is going to produce a large number of eggs. In hyporesponder, we generally start with a much higher dose, could be somewhere around 300 to 400 IU of injections we would give per day in a hyporesponder. In a normal responder, we usually give somewhere between 200 to 225 international units or 250 international units per day. So all of this, again, we have to remember age is also a very important factor for the patient to respond. And AMH also gives us a fair idea how they are going to respond, and the antral follicle count on a scan on the second or the third day will help us again decide on the dosage of the injections that would be giving. So these are basically to stimulate the ovaries to produce larger number of eggs. So what happens is, though there is one egg that is produced in the cycle of a woman every month naturally, there are multiple eggs that die away with it. So in IVF injections, we are harvesting those eggs which were supposed to die away by giving them higher hormone injections in order to make them, the ones that are going to die also, to grow and produce an egg out of it. So this is the benefit, and when we get larger number of eggs, then we have larger number of trial the patient can undergo of embryo transfers. So the more number of eggs will cause more number of embryos, and she will have multiple chances of embryo transfers. That is advantage. And disadvantages, sometimes when we have this very large number of eggs, as in hyperresponders, the quality of the eggs may not be very great. And even in hyporesponders, where we know that the egg numbers are already very low, either because of the age or other reasons, we know that the quality of the eggs would not be very great. And the side effects as such, there is no such side effect in a short term, because these hormones are usually washed away from the body in 2 to 3 days time. So there is no short term side effects because of the hormones. But when multiple cycles of IVF are taken, probably more than 4 or 5, could later cause a slight increase in the risk of developing ovarian and endometrial cancer.